Hi everyone, in this video I am going to discuss about kidneys, simply the overview of kidney. So basically kidneys are the excretory organs in human body, which means kidney filter the blood and form the urine. Okay, so what are the functions of kidney? So to remember the functions of kidney, you have to remember a mnemonic, a weight bed. So a weight bed, A stands for acid base balance. So our kidney balances our acid and base mechanism. Then W stands for water balance. Our kidney also regulates it water balance. Then it also regulates our electrolyte balance. Then it removes toxin. Then B stand for blood pressure. Our kidneys also control our blood pressure by releasing some hormones and some chemicals. Then E stand for erythropoietin. Erythropoietin is a hormone which helps in blood cell formation. Then last D, simply vitamin D metabolism is also occur in kidneys. So these are the basic functions which performed by kidneys. Now we have to discuss about anatomy of the kidney. So first of all, here's a fun fact about kidney. The right kidney sides lower than left due to the location of liver, because there's a liver presence of liver which uh, lowers the location of kidney. Then the anatomy of kidney. This is the structure of kidney, in which this is a renal cortex and this is a renal capsule, and inner this is renal column, and that there is a papilla, and these triangular shaped are called as pyramids. Then after pyramids, this space is known as renal pelvis. Then renal pelvis, there these are major calyx and these are minor calyx. And from here, this portion is known as renal hilum. Simply hilum stands for where the blood circulation occur, or blood flow, or blood routes. So in renal hilum there is renal vein, renal nerve and renal artery, which uh, which provides or perfuse the blood to kidneys. Then there is a renal medulla, and last there is ureter. This is the simply anatomy of the kidney. Then there is a terms which you have to know about kidneys. So term number 1 is dysuria. Dysuria simply indicates pain during urination. So if you have pain during urination, this term in medical is known as dysuria. Then the second term is nocturia. Nocturia simply means if there is excessive urination at night time, is called as nocturia. Then there is hematuria. In this, the blood comes in urine. This term is known as hematuria. Then there is frequency, which means voiding or urinating more than 3 hours. Then urgency, which means a strong desire to void. Then last I have incontinence. In incontinence there is involuntary voiding. Then enuresis. Enuresis simply involuntary voiding during sleep. If you have involuntary voiding or urinating process during sleep, this term is known as enuresis. Then proteinuria. If there is abnormal amount of protein comes in urine, this term is known as proteinuria. Then there is oliguria. Oliguria simply refers to little. If there is decreased urine output than 400 ml per day, this term is known as oliguria. And N means absent, and urea means urine. If you have less than 50 ml of urine output per day, this term is known as anuria. And last we have micturition. Micturition simply means voiding. The process of voiding is known as micturition in medical terms. Then we have to discuss about urine formation. So urine formation occur in kidneys as we discussed earlier. So the first step involved in urine formation is glomerular filtration. So glomerular filtration, here the blood flows into kidneys and the glomerular filtration rate is 120 ml per minute. So filter waters, electrolytes and small molecules come into glomerulus and the large molecules stay in the bloodstream. So in this way blood filter in glomerulus. Then the second step occur in urine formation is tubular reabsorption. Here the fluid moves from renal tubule into capillaries, from where they reabsorb fluid into venous circulation. Then there is a third step which is known as tubular secretion. So now the fluid moves from capillaries into the renal tube. First these were moving from renal tubule to capillaries, but now the fluid again moves from capillaries into the renal tubule to get eliminated and excreted from the body. Then here the urine formation occur and the last step is urine excretion. So the adult should void 1 to 2 liters of urine per day, no less than 30 ml per hour. So in this way the urine formation occurs in our kidney. So this was the whole concept or simple overview over kidney anatomy and physiology.